And she is also trained in 2D and 3D facial reconstruction at Central Forensic Science Laboratory, Chandigarh, in the year of 2016, and also went to the fellowship in forensic odontology from SDM Dharwad under Dr. Ashit Acharya sir in the year of 2018. She has authorized and co-authored over 30 publications in international and national high impact factor journals, including many systematic and scoping reviews. And I think she ma'am has done a few chapters in books also, and her research is well received in scientific committee with over 340 citations. She has reached out to the scientific committee and students, both national and international, with many workshop and lectures in her areas of expertise and interest. We, Savata Dental College and CIMATS, Savata Institute of Medical and Technical Sciences, and from the Department of Forensic Odontology, I am welcoming you to this online platform, ma'am.
Thank you so much, Dr. Abhirami. Is my voice clear?
Yes, ma'am.
Thank you so much for this opportunity for the beginning. And shall I share my screen first?
Yes, ma'am.
Well, today I'm here for dental age estimation, multidisciplinary approach. Actually, before this, I definitely would like to thank Dr. Abhirami for giving me this opportunity. But you know, Dr. Abhirami, that your association with us, when you tell us to take lectures, every time you tell us to take lecture, there is a storm here in Delhi and there is a lot of rainfall in Delhi. So I was really hoping that the last time what happened should not happen this time. So
Yes,
yeah,
ma'am. I
but
have remembered that Dr. Raman Chaudhary sir
yeah,
was flying here
that's
and there.
that's what I'm saying. Today also we had a lot of rainfall in the morning.
But here it is normal, ma'am.
Luckily,
Yes.
it's fine now, so you
You
can
are
hear
lucky,
me.
too lucky.
Yeah, so you can hear me.
Yes, ma'am.
So dental age estimation, it's a topic in forensics which is very very close to my heart. I work a lot in this aspect, practically, theoretically, writing papers, publishing, doing on forensic on-field scenarios. But you know, there's a catch. You know, talking about age and that too by a woman. I mean, it's a dichotomy. But yeah, I am interested in this field, so I am here right before you to speak on this. And my disclaimer definitely is that I don't know everything about the subject. I have definitely, you know, improvised on it by working practically in this field, and that's what here I am to share with you. I'm here to take you to a journey with me, which I have traveled, and maybe, you know, you can learn two things on the way and maybe teach me a few things on the way. This is definitely not exhaustive and complete, but yes, learning is never complete. So we are here to learn from each other. I have also included, I'm an orthodontist, a clinical practitioner also. So I have also taken a few of radiographs and photographs of my patients after taking due consent from the patients, just for the explanation and the academic purpose. This is my team. I would like to introduce my team because we never work alone. We always work in a team, and that's how it should be. And since my topic itself says it's a multidisciplinary approach, so definitely that we would like to involve people from the other branches and we come together on a common platform and share our common interest in age estimation. Dr. Aman Chaudhary is the first person, and he's the professor in oral pathology in Faculty of Dentistry, Jamia Millia Islamia. The second is Vanshika Jain. She was a student with me, and the first article that we published in a PubMed index publication, she was just in second year. So I would just like to tell you that there's no age to start. You can start anywhere, everywhere. You just need to make a beginning. And after that, she has been publishing regularly with us, and now she's currently employed in DRDO, which is a defense research organization in India and highly reputed. And so, you know, it works a great deal. Professor Deepika Bablani is also professor in oral pathology in our own institute. And we all work together on common platforms, and dental age estimation is one of them. Well, age we've talked about of late. What we've been hearing about age is basically about vaccination. So one day a ruling comes that okay, above 60 or senior citizens are going to get the vaccination. Then another ruling comes that, okay, above 18 is going to get the vaccination. But then how do you determine 18 and 60, 65? How do you determine that? So that's what we are here to talk about. But apart from that, India has a lot of other problems also to face. I'm not saying that this is not the problem of the world, but yes, we have our fair share of them. We are a developing country. We have a lot of issues related to the birth registration. In Europe, the birth registration, Dr. Emilio is here in this lecture itself. And there, 100% birth registration is there. But in our case, it is still 60 to 70%. So you can imagine that if it's not 100%, we have to look for other ways to find out the age. There's a lot of child marriage which is prevalent in India. And according to the UNICEF data, 1 in 4 young women in India are married before their 18th birthday. 102 million married women are below the age of 15 years. So you can imagine the plight. And of late, if you look at the newspapers, these COVID times have made the situation so bad that people are taking the girls out of the schools and marrying them off because of the financial constraints. So, age has a lot of factor to play, because you can't marry a girl before the 18 years of age. There are so many crimes which are happening in India, and they are rampant, on the rise, and they're all being performed by juveniles. But how do you determine the age of the juveniles? Everybody, I think, resonates with the Nirbhaya rape case that happened a few years back in India. And it's very, very close to our hearts, because we were really shocked by that incident. And the only person who was most brutal was a juvenile, and he was not given a due sentence just because of 2 months of lag. So, age becomes so important in these crimes. Then there is so much of child labor. You have seen this labor here and there, everywhere around you. But do you report that? No, because you don't even know whether the person has the right documents or not. How will you determine the age? So we have to look for the other parameters to determine the age. Then migration is a very big problem these days. There is so much of unrest in so many places, and many of the migrants are coming to India, or going to the various places, and they have their own benefits related to the migration policies. But for that, we need to ascertain the age, the right age of the migrants. So, age is really, really important to diagnose. Well, my contents for this lecture are primarily divided into definition, importance, application, methods of assessment, interdisciplinary approach, as this is the main criteria for my topic today, and the research prospects. I'll be discussing everything, and I'll be giving a brief, a brief overview of everything, because it's a huge topic. You can't just complete it in 1 hour. And, and also it's difficult to hold anybody's attention greater than 45 to 50 minutes. So I'll just try to give you short capsules about everything. So according to the definition, Ritz and Tim said that the forensic age estimation refers to the expertise in forensic medicine, which aims to define in the most accurate way the chronological age of the person of an unknown age involved in judicial or legal proceedings. And anything which has to be submitted to the court has to have a certain amount of accuracy. And when you don't know, when the age is unknown, you have to look for more than one method to reach to a conclusion. It may be a combination of dental, skeletal, it may be a combination of 2 or 3 dental methods. But yes, definitely, if you have to produce something in the court, it has to be with the certain degree of accuracy. So where did the age word it comes from? It is basically a social construction. It's a communist entry. But the one thing that if you go back and think that nowadays it is possible to change the gender, but you cannot change the age. So this is a social construction which is stuck onto you for life. It keeps on changing, and you need to continuously evolve and continuously determine the age. Why it's important in health sciences? Well, we as orthodontists, we take use of the growth remaining of the age status a lot. in our practice, because there's so many treatments. These are my own patients' photographs that I've taken. And if you see in the photograph, the upper jaw, the maxilla is backwardly placed, the lower jaw is forwardly placed, and we've given a face mask to the patient, and you can see the results. But there's a age to it. If I try to give the same treatment when the growth status is complete for the patient, then this won't work. So in a lot of our practices and treatment options, we need to determine the growth status of the patient. And for that, definitely we need to assess the age of the patient. We also need to know not only the dental age, but the skeletal age of the patient. And even the endocrinologist or the pediatricians or the periodontist, they take a lot into their practice, the skeletal age and the dental age phenomenon, not only for the diagnosis, but also to determine the prognosis. If the same patient, I leave without treatment, the lower jaw is going to grow because the growth is still remaining. So the prognosis also is being determined by this age status. So it's very, very important in age. Now, when we come to forensics, not only in the health sciences that we talked in the earlier slide, but when we talk about forensics, you won't get a complete face, you won't get a complete structure. These are few of the cases which had come to us, so I would prefer that you do not take any photographs in this. But I would just like to highlight that these are the cases that are going to come to you sometimes in forensics for comparative or for reconstructive identification. Now, in reconstructive identification, we mean that we don't know anything about the case. We don't know the age, we don't know anything about the case, and we have to reconstruct that. In comparative, you still have some photograph or something to go back to, and you have to compare it to a known age. So in both the cases, we need to ascertain which method is most applicable for determination of age. When you talk about the medical board, well, the medical board will not tell you, okay, there's a dentist in a government college, and this is a case, this is a rape case, or this is a homicide case, or any mass disaster case, and you just get a dentist here, and you just tell us, okay, this is the skull of the patient, of the individual, or these are the records of the individual, and now you tell us the age. This doesn't happen. Wherever you go for age assessment and a forensic case comes to you, there is a board which is set up, and that board has primarily three major constituents. You can have others also, but dentist, radiologist, and general physician are a must in this board. So as I said, it is a multidisciplinary approach. Not one person can tell you, okay, this is the right age. A dentist cannot tell you, a radiologist cannot tell you, but a general physician cannot tell you. But they can combine their results and reach to a certain level of accuracy. There is an AFCAD, which is a study group in forensic age diagnostic. I found their way to be most comprehensive of all. And this should be adopted because they have taken all the ages together. The developmental age, which is basically determined by the increase in height, weight, stature, that's basically the developmental age. And there are norms in each population for that. If you look at the Indian norms, even the Indian pediatrics department, they have published so many norms and they're continuously being updated. So for the developmental age, the physical age, we have to look for those parameters based on the physical examination. Along with that, they have the dental age criteria and the skeletal age criteria. And for the skeletal age criteria, they have taken the clavicle, the hand wrist, and for dental age, they have taken the OPGs. So this is a primary constituent. You can keep on improving it. You can add on to it. But this is a basic constituent that you should have. When we talk about dental age, which we are here to talk about today, why is the dental age so important? Why are teeth so important? In any forensic scenario, whether you have a mass disaster, you have any case of crime, or even a civil case, a criminal case, any case you have, these teeth are the ones which are highly mineralized. And they're the last ones to break, they're the last ones to disintegrate, and they have a lot of DNA in the pulp in them. So it is very, very important for the forensic point of view. It also has a low variability related to the age, and you have certain parameters for its eruption, mineralization. You have certain norms, certain parameters available for it, which you can easily compare with the records that you are made available to. They're the last ones to be destroyed under pressure or temperature. And more or less, any ethnic community will have dentists which will be having good record system of the dentition or the radiographs or the study cast. They would be having something or the other related to the teeth, which they might not be having related to the medical history. So definitely the record system in dentistry is much better than in the other systems, and that plays a role when we talk about the forensic age estimation. So based they can be classified in different ways. How you can classify the dental age? You can classify it into different ways. You can classify it on this base of stages of development, on the basis of how you estimate the age, whether it is comparative or calculative, or also on the methods of examination. Based on stages, you have prenatal, natal, postnatal, children and adolescents and adults. But on method of estimation, you have comparative or calculative. When we talk about comparative, comparative is, as it explains itself, something to compare to. Calculative is that you're calculating based on any regression formulas, any scoring systems. So that is calculative. And based on the methods of examination, you have visual, histological, physical, radiographic, digital. We'll talk about that. This is a mind map. Now just look at this. This explains everything related to the age estimation methods that we study. In the prenatal, you have histologic, physical, and radiographic. In the children and adolescents, you have visual, radiographic, digital, physical, and histologic. In adults, you have also morphologic parameters added to it, along with the visual, biochemical, histologic, and radiographic. And if you look at the right side, it will be giving an explanation of all the methods. But for now, we need to understand what is present in these methods. So let's have a look. When we talk about prenatal, neonatal, and postnatal, well, we have, apart from calculating the weight of the dentition, we have other parameters which can be based on the ground sections of the teeth. What happens that when we talk about the deciduous dentition, the mineralization, it starts very early, in the intrauterine life. 20 to 28 weeks of intrauterine life it starts, and the last deciduous molar, it gets calcified by 3.5 to 4 years of age. Everybody knows that. We've studied that chronology. And for the permanent teeth, if we talk about, the calcification, it exceeds and it continues up to 20 to 25 years. So we have a lot of time span. But when we talk about the prenatal, even if you take prenatal and the neonatal, if we take the radiographs, it would not be visible that much because the mineralization is very less. It's just in the first and the second deciduous molars. You will see a slight fusion on the top of the molars, and you will see slight mineralization in the permanent first molar. So that will not be too much visible in the radiographs. So you can do the alizarin staining of the fetal tooth germs for that. Apart from that, if you have to see whether the child was a stillbirth or it was a living individual when you have to do the age assessment, then the neonatal lines play a role because there is a complete environmental change when the child comes from within the womb to the outside, from the intrauterine to the extrauterine life. And there the neonatal line is formed. Now it is based basically from the neonatal line, the incremental line patterns are calculated and it's based on the amount of enamel or the amount of the calcification which is going to happen per day, and you can easily divide it into the width. So the incremental lines also play a role in the age. Apart from that, then we have the if we have the radiographs, you can also look the Nola staging into the radiographs. So from the no crypt in the 0 stage to a slight mineralization to a tip mineralization to complete crown formation, then the root initiation, then 1/3 of the root, 2/3 of the root, then complete calcification. All these stages, if you're lucky, you'll be able to see in different stages of the child's life. So this is how we see in the radiographs. When we talk about children and adolescents, well, this is a very beautiful picture, which I think everybody has seen whenever you study dentistry. So as I said, when we talk about a multidisciplinary approach, you can also include your undergraduates into it because when you start teaching them dentistry, the first thing that you teach them is chronology, and you teach them this chart. This Shure and Massler chart was given in 1941, and imagine it's still applicable till now. because it has given a staging after a few months, from the intrauterine life to the 35 years of age. It has given in complete sequence, in a gap of few months or few years, they have given the staging of mineralization, of eruption. You can see that eruption and you can easily tell, okay, this is the age. But that is a very rough age, because this is an atlas method. You are just comparing, okay, you have a visualized pattern of this in your mind. And when you look at the cast, you see, okay, this molar is erupting, this incisor is erupting. So this must be the age of the individual. So that's how you calculate the age. And that's many a times, when you look at the board of, when you are called for the board for age estimation, they'll just be giving you casts, or they'll just be giving you radiographs, and they'll tell you, okay, you write down what is the age. That's not the right thing to do. You can take this as a measure, but as I said, we should always combine it with the other methods also, with a certain degree of accuracy. But this is how, and the chronology, since we know when is the calcification beginning, when is the crown completion, time of eruption, root completion, everything, the age, this is imprinted in our mind right from the undergraduate level. So it becomes very easy. So since we all are dentists here, if I ask you, what is the age of the first picture? So you will tell me, okay, this is like the first molar has erupted, and you can see all the deciduous teeth have erupted. So since this has just erupted, so it might be, maybe 6 to 7 years. Okay, the incisors are permanent and the first molar is permanent. Okay. Then if you look at the second stage, the ugly duckling stage, everybody knows the canines have not yet erupted, maxillary canines have not yet erupted, and you can still see a gap in the front teeth. That is the ugly duckling stage. It is a self-correcting anomaly. But if you get a cast like this, you will immediately say, okay, the child must be somewhere, between 11 to 12 years. If you look at the third molar is erupting, and you can see the operculum there. So you can say, okay, the individual must be above 18, or you can say that. So this is how we have been trained to look at the patient's or the individual's mouth and look at the age. The same way, these kind of casts you get while you are estimating the age in any board that you sit, the age estimation board that you sit. And this is how the approximate age you reach. But apart from that, now the London Atlas Al-Qahtani has also given this London Atlas. They have also quite modified it into, because they have reduced the age gap where they have given the pictures in utero as well as in the postnatal time. So this is also a very extensive atlas, which is being really used these days, and it is really, really effective. The accuracy is much more. And moreover, it is more automated, because if you go at their software, it is very easy to implement, and you can just put the tooth number and the staging based on the radiographs, and you can easily reach the age. So as you progress, you make it more simpler, more easier, more accurate, and more automated. That's what the London Atlas has done. When you talk about adolescence, the emergent method was given in 1973. This is still the most widely used method. It has been used almost in all the ethnicities, in all the age groups, and even Indian, there are a lot of Indian studies also on the emergent method. And this primarily, when I first saw this article, this was around 20 to 22 page article, 1973. And when I started reading it, it was so huge, by the time I reached the end of the article, it was really, really difficult to comprehend. So, but I fell in love with the method. So I thought, why not simplify it? Let's look at the original Demergent first, and let's see how I simplified it further. So this Demergent method actually uses the mandibular 7 teeth on the left side, from the central incisor to the second molar. This is the given in the Demergent article, and there you have to see the calcification stages, and you have to ascertain the age. This is how I have simplified into it, the Demergent method, into a comprehensive chart, which is a DACC chart, and it was published in year 2016. And as I said, that my student Vanshika Jain was there in this article with me, and this was done in her second year. So we kind of made just one chart into it because we were tired of reading that whole article and going through various tables, and it was so difficult to comprehend. So we put all the developmental stages into one chart. We drew them ourselves and we interpreted them ourselves. And then we put the scoring of Demergen into this. And finally, it was just one chart. And if you look at this, you can just fill the chart and the age comes to you. So where to assess? As I said, you have to assess this Demergen method on the left mandibular side from the central incisor to the second molar. FDI notation we have given, while the original Demergen, it used the incisor IMC, that category, they used those notations, but we use the FDI notation of 3.1 to 3.8. So how was it done? Step 1, you take the orthopetomogram of the developing individual. Then this is basically the stage of development of the tooth. You have to match it to the development of the tooth. This is basically the maturity score, which is given separately in the original Demergen method. And finally, when you reach that score, you look into this male and female chart and you find out the age of the individual. So you can see so many different tables, so many different charts. But when you look at the DACC, how we did it, this is how we have traced the OPG of the developing individual. The mineralized area has all been traced and you can easily decipher it. The white portion on the radiograph, it represents the mineralized area. This is basically for the undergraduates if you don't understand. Obviously, everybody else understands it. But the mineralized area is represented as the radiopaque area. So we kind of trace only the radiopaque area and we only trace the permanent erupting teeth. We don't trace the deciduous teeth in this. And then you break this chart into sections and you start filling it. So the first section is the demographics of the patient. You fill the patient ID, gender, data, dentition present, nationality, very, very important. The date of birth is very important. It so happens that even in our orthodontic practice, sometimes, we lack ourselves and we don't ask the date of birth of the patient. What we write is the age is 11 years, but we forget to ask the patient about the date of birth. Please be very specific. Whatever patients you are doing, please note the chronological exact age of that patient, because that is really going to help you in your further forensic research. Then this is the second part of that chart. So as I said, that we've already drawn the staging into this and you have traced that. So now you just have to match the stage of the calcification of the tooth present in your tracing to this. So if it's incisor, that is 3.1 and 3.2, you have to look which staging is relevant and you have to circle the scoring. Yes, there is one catch point here. If it's a boy, you have to take the left side scores. If it's a girl, you have to take the right side scores. So you just have to circle the relevant scoring here. For incisors, both of them, these are the staging that you have to take. For canines, this is the staging. For premolars, this is the staging. And for molars, 3.6 and 3.7, this is the staging. Just remember that if the OPG that you have, if is of male, then you have to circle the left side of scores. If it's of a female, you have to circle the right side of the scores. So this second part is completely filled now. Let's just quickly go through it. As I said, this is the staging. This is how, and it was a girl. So we click the right side. Again, this is a canine, we click the right side. This is a premolar, we click the right side of the scoring. Molar, we click the right side of the scoring based on this was what was the drawing and we matched it to this drawing. Then in section 3, since you have marked all the scores, now you have to add up all the scores and you get a total score. Now comes the tables. So you have got the total score and now you get the age. You have to look at the corresponding age, and since it's a girl, so I'm looking at the table which was meant for the girls. So I get the total age of the individual. So now I can either, if it's a comparative thing, so I already know the age, so I can see whether it is underestimation or overestimation. And if I'm doing a reconstructive thing, then definitely I can give an approximate age of the individual. So this is the calculated age. We've also modified this chart for the modification of the Demergen method, which was given by Shalit and Demergen in 2004. And how this was different from the DACC 7, because DACC 7, it included only till the second molar, left mandibular second molar. But when you talk about Shalit and Demergen modification, they also include the third molar, because the preliminary method was just meant to decipher the age till 16 years. But since the eighth tooth is included in this, the third molar is included in this method, Shalit and Demergen modification, so you can assess the age between 18 to 25 years also. And we modified again, this again is modified into a chart, and I've also given this total maturity score is here. And you won't need tables for it, because in the Shalit and Demergen method, they've already given a regression formula, which is also incorporated in this chart. And Ashit Acharya has also given Indian formula for it, which also we have incorporated in this chart. So this is also a one-stop shop for age estimation between 18 to 25 years. So again, what can be the use of these charts? Well, I'm propagating these charts because they're so simple. If we just send you the articles, you can easily, your undergraduates, your postgraduates, you can do it on a large, huge data of sample, and you can include it in the forensic odontology manuals, because they're just two charts that you can put, and it can be a good practice session or a good forensic on-field session for the people who are doing age estimation. And also this chart is being used in Punjab, it's being used in Chandigarh, it's being used in Haryana. All these are using it for the forensic age estimation, because they just take the chart in the board and they start filling it. And it does not take a lot of time. You can easily fill it in one go. And then different levels of experience can be possible with this radiograph, because sometimes you feel that you need a certain amount of expertise for it, but this is just with practice. If you look at the charts and you keep on filling it again and again, even the undergraduates will be able to do it. So, and we are holding so many workshops for it to make people aware of it. And you can also use it in different conditions like cleft lip and palate or different syndromes. You can easily start using it, and you can start it right away. We are also in the formulation of automation of these charts, and also in the formulation of interpopulation studies. So you're most welcome to join our gang for this. The other methods are originally, NOLA gave the staging system, which is still being very much used. Demergen also used that. And there was an appropriate fraction that was recommended in this. Haviko method was used, and it was based on 4 reference teeth. Basically, they said they used only the 4 teeth which don't show too much of variation, like the molars, the incisors. So they used those. Willems definitely is being used nowadays much more than Demergen also, because they feel that it is much more applicable. It shows less overestimation or underestimation. It's more accurate than the Demergen method. But these are all ethnicity based studies, and you can do it in your own population, and you can find out which of the method is much more applicable in your own population. And definitely, as I said, that whenever you do age estimation, you should not just concentrate on one method. You should always use more than one method. So you will easily come to know which one is more applicable. Then latest, this Kemry's open apex method is also being used in children and adolescents. And this is basically, Dr. Kemry has become also a very good friend of mine, because I've been conducting workshops with him, and I also attended his age estimation workshop in Cappadocia 3 years back. And ever since, we've been quite in touch, and his methods also I feel are really, really applicable. And I would really recommend that whenever you do Willems or Demergen or DACC, you should also be doing these latest methods also, as I said, more than one method. So take an OPG and locate the 7 mandibular teeth. This open apex method is basically why it is called open apex, because this is on developing teeth, and you know that the apex is not closed. So you have to locate the distance between the open apex and the length of the tooth. So as I said, this tooth length is measured 1 to 7 on all the teeth, and then the open apices, they are added for all the 7 teeth, and you get a variable S. You put it in this formula, and you get the age. You also add 1 for boys and 0 for girls. So this is basically how the OpenApex works. This has also been tested a lot, even in Indian population. So you can do it in your own ethnic population. Like there was a researcher who was interested in doing this along with DACC in Orissa population. So you can do it in your own population and find out which one is more applicable, more accurate. So you can easily form the regression formulas for it. This is basically a whole culmination of all the standard charts that have been used and how the basis for comparison was formed, how the data collection was done, how the teeth was studied. This I've compiled it in my chapter, which I've done in the book that we published on Handbook of Forensic Odontology in 2018. This is the first edition of the book. And this was the chapter which gives you the whole scenario about the age. Well, the merchant system has also been upgraded, and a lot of artificial intelligence has also been applied of late into it. And Dr. Patera has also published these 2 articles on artificial intelligence in the merchant system. Basically, what they've done is that the mandibular premolars, they have the emergent mandibular premolars, they have kind of automated the staging of those premolars on the radiographs. And it is basically based on all you first feed a lot of radiographs and you try to train the machine learning aspect based on the convolutional neural network, and then you kind of find out, okay, this is the automated version of the staging of the mandibular premolars. Region-based segmentation has also been done. So these are the few aspects which have been very recent and they've been applied, and they're more accurate and more automated. Well, now we talk about adults. So yeah, at my age, getting lucky means finding my car in the parking lot. Otherwise, it gets very difficult. And flowers scare me. Yeah. So of all the methods that we talk about in the adults, morphologic, radiographic, histological, biochemical, visual, the most commonly that is being, or the most prevalent is Gustafson's method, but which is very, very old also, but it's very, very elaborate because it takes 6 parameters into consideration, like attrition, secondary dentine deposition, apical migration, cemental apposition, root resorption, root dentine transparency. And for this, it's not possible all in the radiograph, so you might need to have extracted teeth for it. And there is a scaling of points of 0 to 3, and there's for the 6 criteria. So the maximum scale that you can get is of 18, and 0 to 3 is for each parameter that you can see. Attrition, based on how much it has progressed, it is either 0 or 3. Dentine deposition, as we know, that secondary dentine deposition happens not only by the aging process, but also by various insults that happen on the tooth, like the masticatory insults or any malocclusion insults or any environmental insults. So the secondary dentine deposition keeps on happening. It's a continuous process. And our pulp cavity, it keeps on getting narrower. So that also is a progressive phenomenon, and it can be classified into 0 to 3. Then the apical migration, depending on the periodontal condition, the apical migration of periodontal ligament happens. So that also is classified into 0 to 3. Cemental apposition, because of the insults and the masticatory phenomenon and everything, there is a thickness of cementum which happens as the age progresses, and that also is classified from 0 to 3. Root resorption, definitely, again, the external apical root resorption can happen. Classified from 0 to 3. So this is the Gustafson's method, but very, very extensive. Cementum annulation method is also used quite often when all the calcification and the staging is complete. And it's basically based on the regular apposition of the cementum. It is basically a phenomenon which is seen under the light microscopy. And because of the presence of the acellular extrinsic fiber cementum, AEPC, surrounding root, it appears as the alternate light and dark bands. There may be many reasons for it, like function, emergent, pathological process, and you might require some armamentarium to visualize it, like bright field microscopy, polarized microscopy, phase contrast microscopy. You can see whatever is there available in your own institute. You can easily make use of it. Dentine translucency, there is a bang and ram phenomenon. Even the Indian formula, Ashuta Acharya sir has, modified it into a modified bang and ram formula. So if the length of the apical translucent dentine is greater than 9, then this formula is happening. If it's less than 9, then this is happening. Again, other formulas like pulp tooth ratio of Kemery 2004 method is also there. So all these methods, you can apply any method, but you should always mention what is the level of accuracy in those methods. So we would recommend time and again that if you are doing ethnicity based studies or population based studies, please apply 2 or 3 phenomenon so that you know what is the level of accuracy for each method. So this is Dr. Cambry, and he has given a lot of methods like pulp-tooth ratio, open apices, third molar maturity, carpal and epiphysis, epiphyseal fusion, fourth cervical vertebra. So any of the methods can be applied for age estimation. Another phenomenon that you can use is tooth wear phenomenon in adults. So there are few authors only who have worked on the tooth wear or the attrition phenomenon. Kim gave the initial phenomenon, but Lee and G, they modified it. And you can see this is the level of pictorial representation of the attrition that they have given and the related formulas for it. Again, you can easily combine 2 or 3 phenomenon and see which one is more applicable to your own population. You have biochemical methods like racemization of aspartic acid, because the L amino acids, they're going to change to D, and you can see what is the level of transformation that can be seen in the histological methods. Radiocarbon dating, again, it is very, very specific, because it was given by Spalding in 2005, and it can precisely determine the chronological age based on the level of radiocarbon or carbon 14, which is present in the tooth enamel. And it will exactly represent the amount of the radiocarbon which was present in the environment at that time. So that's how the radiocarbon dating happens. Fluorescence can also be one of the methods that can tell you what is the age, because this is a phenomenon which has recently been explored, that the UV light, when you apply it on the tooth, then it emits a wavelength which is longer, and you can see the fluorescence, and that can actually tell you how much of cementum deposition or the dentine deposition is there. Dental color, okay, that can also be determined, because the time from the death, also the color of the teeth changes at different intervals, and that also can tell you, basically it's because of the collection of disintegration products of blood in the dentine tubules, and that can also give you an indication of what is the age. Artificial intelligence, again, here is also, it's also being applied in dental age estimation. So my journey, which I have taken, I'm going to take you through that. So I have first gained the knowledge about these various age estimation, not only the age estimation techniques. When I did my fellowship in forensic odontology under Dr. Ashita Acharya in 2016, so at 2018, I'm sorry. So at that time we were exposed to different methods. So we kind of, you have to try your hand on different methods, and then you have to reach to the method which is most applicable. And since I'm an orthodontist, I have a regular access to the lateral cephalograms, to the OPGs, to the various tracings, to the models, to the 3D models, even the photographs. So they really play a good role when I talk about any of the forensic aspects, whether it is identification or age estimation. This was the whole gang in the fellowship area. And this was where, as I said, when I went to Cappadocia, this is Dr. Cambry's age estimation workshop. So I've gathered knowledge from the stalwarts themselves. And then we worked together, as I introduced my team in the very first slide, Dr. Aman, Dr. Vanchika, Dr. Deepika. So we started working together because we found a common ground, to apply all that knowledge that we had gained from various aspects, and to apply it and publish our work. So this is 2016 DACC chart got published. It was also applied in the Haryana population. This got published. Then it was also validated in very recent 2019. Then DACC 8 got published again in 2018. And this is a very recent article which I published in 2021. This is again our team which has been introduced to you. And orthodontist in forensic dentistry, one of the roles is age estimation, because we have access, as I said, to a lot of radiographs, to a lot of models, to a lot of photographs. So when we talk about the photographs, radiographs, and models, these are the ones which can actually tell you, give you a lot of raw material to determine the age. And when I talk about multidisciplinary approach, sometimes, you would also like to do it on 3D radiographs. So even the oral radiology persons may be a lot of help to you. Then the oral pathologist can be so much of help to you when you talk about cementum annulations, you talk about neonatal lines, you talk about any histologic parameter. So there can be a lot of help to you. So as I said, please don't restrain yourself, don't limit yourself. Please open your horizons, formulate a team, because that is the way to go forward. It's not only you. And nowadays, you can also involve the people from the computer background, because everything is going on to machine learning, to artificial intelligence. And if you have to automate even your own charts, you need a lot of help from them. So it is definitely a multidisciplinary approach. Then you disseminate in the form of workshops and lectures. So you see again my gang, which is there in the crime, all the crimes with me. So we went to so many different places all across India, even to Bangladesh and different countries. So this is a lot of good memories that we have. And we disseminate our knowledge in these workshops and lectures. Ongoing work, we've also tried the Cambridge Open Apex method very recently in the European and Indian formula in Delhi and NCR population. And since this was a very small sample study, only on 100 radiographs, so 50 males and 50 females. So the pilot study results have come out to be that the males show underestimation by 0.86 years, and the European formula underestimation, it shows by 0.9 years. So Indian formula is definitely more applicable. Data of females definitely shows that the Indian formula has underestimation by 0.5 years, and the European formula has underestimation by 1 year. So definitely the Indian formula is more applicable. So we are using this to formulate large sample studies, and which I think is the right way to go. The combined data says that the Indian formula underestimates by 0.7 years and the European formula underestimates by 0.9 years. So you can also apply it in your own population. Currently, we're also doing the dental age estimation in cleft lip and palate. And since this is also one of the areas or arenas which I work very regularly in the clinical practice, we give a lot of appliances in these cleft patients. But many a times, these cleft patients are from the backgrounds where they don't have the age related data with them. It's very difficult to extract chronological age from them. And we want to find out whether we can rely on the eruption status of the teeth for these kind of patients. So we are comparing the cleft patients to the normal patients, and believe me, not even one Indian study has been done on this. So we are in the process of using the DACC chart along with Willems and the other methods, and we'll be soon coming up with the results of this study. But it has also been used in other ethnic populations like the Turkish population, Egyptian population. They have used it in their own cleft lip and palate patients. And definitely they have seen many of the studies, they support that the dental development in these patients is slightly slower than the normal healthy patients. Apart from that, you can also have the other craniofacial syndromes, which can show the dental development to be not in sync with the healthy patients. Like the Down syndrome patients, many a times, these Down syndrome patients do not have the age-related data, because they are many a times in very early stage. They are put for adoption, and when they're put for adoption, the adoption houses, they don't have the exact data with them. So it's a big problem, and you should target even these syndromes if you are doing any age assessment studies. So right now, when I am talking, I am side by side with every slide telling you, okay, these are the research options, that because that is also one of the criteria that I had mentioned in my very beginning in the content of the lecture, that I'll be showing you what are the research options that you can avail with this lecture. Archaeological evidence also, a lot of methods have been applied for the archaeological evidence, even for the fossil evidence. So basically, even the dental traits, the metric traits can be used for the dental age estimation. So basically, but for that also, you need to have data on a large sample. Like the Mooreys had done two longitudinal large sample data studies. Even they are being used for the fossil evidence and the archaeological evidence till date. Then the comparison with skeletal age assessment. Well, again, this is a topic very close to my heart, because this is almost in every patient that we have to take a lateral cephalogram. We have to take an OPG. So we are used to looking at the cervical vertebrae of the patient to know what is the growth status of the patient. We look at the cervical vertebrae, we assess the cervical vertebral maturation index, CVMI status, and that is present in our history records. For every patient, we measure that. And as I said, that's one of the skeletal age assessment methods. There can be other skeletal age assessment methods also, like the hand raised radiographs or the clavicles. Clavicles have come up in a big way, but they're not available. You need specific radiographs for it. Lateral cephalograms, because we are already taking, we don't need to expose the patients for additional radiographs. So we assess the CVMI status and we compare it with the dental age. We can do those comparative studies also. Frontal sinus also can be one of the parameters that you can look for in age estimation. For hand raised radiographs, definitely we have the CVMI, the SMI status that we see. Then the biochemical method. Now you can compare, if you want the research options from me, you can either compare the dental age two methods, and you can compare one skeletal age method and one biochemical method, because we have registered, my team has registered one of the systematic reviews in Prospero, and we are doing the biomarkers in body fluids as indicators of skeletal maturity on radiographs. So since we have now compiled all the biomarkers, you can't believe how helpful they can be to tell you what is the exact growth status of any patient. And the maximum that we've come across till now is IGF, growth hormone, creatinine, alkaline phosphatase. So if you're looking for research options, you can easily take one of these along with one of the skeletal physical parameters and one of the dental parameters. So there can be various research options that you can have. X-ray of hand, Grulikin pile, Thyman, Gills, Ratibin, Tanner Whitehouse. Basically, they also work on two methods. Like, the Atlas method of Grulikin pile, still applicable. I don't believe it. It's so old, but still applicable. Now, they had given an Atlas where photographs of the radiographs are given of the left hand, and you just have to match your radiograph of the hand with that, and you can tell the age. That is, again, a visual method, a comparative method. But then this was again converted into a scoring system by Tanner Whitehouse. So by bone, the scoring system is there. You have to add the scores and you'll get the age. So skeletal age. So that is also one of the scoring method. As I had mentioned earlier, even in the dental, you had two methods, comparative and scoring method. In the comparative method, you have Shure and Massler chart, the London Atlas, where you just have to look at the eruption status of your own radiograph and look at the chart, and you will come to know, okay, what is the age. The other, like Demergen and all, they will resort to some scoring method, like Cambry and all, they'll give you some regression formulas. So both the methods are being used for skeletal age also and dental age also. One is comparative and one is scoring. Apart from that, like as I said, we use the CVMI, that is a cervical vertebral maturation. In this second, third, and fourth vertebra are mostly considered, and different staging system are being given. Automation of these have also been done. So as I said, that every method now is being automated. So, try to look for the computer specialists very fast in your team, because definitely if you're going to apply a method, you will definitely think of automating that. And for that, you need those specialists in your team. Skeletal age also has been automated, and artificial intelligence has been given into the bone age assessment techniques also. Now, once we have culminated all the dental, the skeletal age estimations, now how do we give a final report? Because ultimately, that's your main arena. You have to give a report, which is in writing. So what are the various criteria that you should have as a component of those reports? One can be introduction, one can be inventory of evidence, method of analysis, opinions, and conclusion. In the introduction, okay, how the case came to you, what were the records that were given, the inventory, it comes into that. Then what is the stage of the teeth that you got, stage of the radiograph that you got, stage of the study model that you got, or even the photographs that you got. You have to write down everything, every detail that you've got. Then if you have the age, the height, weight, anything of the individual that you are studying, then you have to even write that. Then the techniques that you are applying for age estimation, you have to write that, and you have to write the level of accuracy of each method that you apply. So that's also very, very important. And it's all the more applicable that if you have those methods being applied already in your own population, then please look for those methods and write only their accuracy levels, because they are more applicable. The two standard deviations you have to measure. Disclaimer, any disclaimer that you want to put, that okay, if any new evidence comes in due course of time, then you will be able to change your conclusion or your opinion based on the new and upcoming evidence. That also, as you can add as a disclaimer. So the summary is that you write the age by two methods. This is the accuracy, this is the standard deviation, and I will be able to change it if any new evidence comes. This is how you write the report. So take home message, I think I completed it on time for the first time. I always over exceed my time, but today I thought that I'll stick to it. So this take home message is basically just based on my own personal experience of my team, of myself. After working so much in this field, this is what you have to look. Find your own niche. Like, I'm comfortable working on radiographs, working on study casts, working on skeletal age parameters. So I will create that as my niche. But if you are an oral pathologist and you want to study which is related to the histology, you want to study which is related to the ground sections of the teeth, which I'm really scared about, so you can look for that niche. You have to start very early. Plan very small studies, maybe in 50 patients or 40 patients, anything. Start somewhere, start early. I would definitely love that after this lecture, if two or three of you, take my mail ID and you tell me, okay, ma'am, we have started this, at least you start somewhere. Target the ethnicity driven studies. Time and again, I've mentioned during my lecture that this is very, very important, because dental age or skeletal age in one population will never be similar to the next population. So you have to look for the methods, look for the criterias which are more applicable in your own population. Use more than one method. Again, this also I've highlighted throughout my lecture. Not one method can ever be applicable to your own population. Maintain the dental and the radiographic records, because they are storehouse of information. They are the ones. Catalog it properly. Like I said, write the chronological age. Definitely ask the chronological age of every patient. Write it down. Maintain the dental and radiographic records, so that anytime, maybe you can want to do a multicentric study, so you have your own data available. Or even if you want to combine all your own data and do a study, so you should have that catalog very nicely in your own institute. Always record the chronological age and formulate an interdisciplinary team. It's always fresh, because they'll give you fresh perspectives. So always formulate an interdisciplinary team. Ask for help. If you are stuck somewhere, we are there to hold your hand. Ask for help. As we can help you, we will definitely help you. And if we know somebody who can help you, we'll definitely refer you to that. So that's my take home message here. These are my references. And this is, again, a picture of the chart that I've published. And for queries, this is my mail ID, my website. So let's make a new beginning, and let's start very early, very soon, even if it's a short study. I'll stop my share now.
Yes, ma'am. Thank you. Thank you so much for that wonderful presentation. Seriously, this is the best presentation I think so, ma'am, I have ever attended. And like, I would like to thank you, ma'am, for this. And please accept this ritual appreciation small certificate for you.
Thank
I'll
you so
send it through
much.
email. And I think we have got few queries, ma'am. So let me read that.
But I would love it if, people start working in this domain. This was the whole idea behind this lecture.
Yes, ma'am. Uh, okay. From Venkatesh Jayaraman, we got questions, ma'am. Shall I?
Yeah, yeah, absolutely.
Okay. What's the AE method you advise for children, adults, and for geriatric persons?
Okay, so this is basically they are asking me in short about the whole lecture. Okay, I'll do that. So as I said, I had presented a mind map, if you remember, in my 13th or 14th slide. So that mind map gives you the whole idea. As I said, there's not one method which I recommend. You have to choose your own method. You have to try two or three methods and see which one is more applicable. Like for neonates, you can look for neonatal lines, you can look for alizarin staining, you can look for weight of the developing dentition. For children and adolescents, definitely, because I'm working on DACC charts, I find them extremely useful and comprehensive. You can use them along with the other methods like Cambridge Open Apex method. You can use that. You can use two or three combinations like Willem's, Demergen, and Cambridge method in children and adolescents. But if you talk about geriatric, definitely I would recommend that you should go for the attrition Lee and G method. That's really applicable. So you can try that, and you can also try the pulp tooth area ratio of Cambridge. You can try that also in geriatric.
And another question is, what is your opinion or preferred method for legal cases like child abuse cases? Legal
See,
methods.
child, okay. Because as I said, if you are presenting something on the legal scenario, then definitely you have to use more than one method. So you try using, again, my answer will be the same. If you're using Cambridge method, or you're using Cambridge Open Apex method, or you're using Williams or Demergen, you have to write down the accuracy with two standard deviations in that. And you have to also give a justification. If in your population some Indian formula has been derived, please start using the Indian formula because it is more closely applicable to your population. So for the legal scenario, anything that you use, it has to be with the level of accuracy and with standard deviations.
Yes, ma'am. Then, what is your opinion about biochemical methods like acetic acid racemization?
See, maybe because I don't do that personally. I am not a histology and the ground section person, but definitely I know because there are people, even in names, who are working on this racemization, and they have found very accurate results. So if you want to try it on a few tooth sample, extracted tooth sample, that definitely we can help you with it. Means your orthodontics department can help you with it, and you can look for premolars which they extract, and you can start doing that. So it's really applicable because I've seen studies from AIMS itself in Indian population where they're applicable. And maybe I forgot to mention that you can also do DNA methylation in pulp, and that can also be used for age estimation.
Then he's asking about few age estimation method by radiological age estimation method that you are advising for children's, adults, and geriatric persons.
So radiological, definitely, as I said, Demergen is really applicable. Willem's, DACC charts, and again, Cambridge method. Cambridge method, when you start using it, you need to download ImageJ, which is a free software. You can start using it. It's a very simple method. You can just measure it, the distance between the open apex and the length, and you have to calculate the ratio, and you can put it in the, directly, you can put it in the formula. So radiological for children and adolescents. For geriatric, again, as I said, these are the attrition method, which I said, that is a visual method. It's not a radiographic method. But if you want to use a radiographic method, then you can try the Cambridge pulp tooth ratio method. So you can do that. Even for the geriatric, you can, maybe not geriatric, but adult patient, you can use the third molar index also. That's also a good method.
But third molar also like till some 25 years we can, ma'am. But after
That's
that,
what I'm saying, not geriatric.
yes,
But for geriatric, you can definitely use the pulp tooth ratio method.
yes, ma'am. And my suggestion is like we can go for anatomical landmarks. Anatomical landmarks in the
That,
size, yeah.
that's beyond the scope of this, since you're just asking me about this. But then, as I said, age estimation is a huge topic. You can go for the gonial angle, you can go for so many different bones, then you can do that. It's
Yes.
very helpful.
Yes, and then the suture closures also it will be helpful.
Suture closure happens quite early.
Quite, but yes, we can, I
We
guess.
can do that, definitely. As I said, age estimation is huge.
Yes,
It's
ma'am.
not possible to culminate it in one this thing, but
Yes.
yeah, dental age estimation, definitely, as they asked, so I answered.
Yes, ma'am. That's all the question and these things. And I'm happy that Emilio sir was watching this for like from the beginning to till now.
Yeah.
And the sir has put a message like
I think
a
Raman
very
is also
comprehensive
here, Dr.
presentation.
William is
Thank
also
you, Dr.
here, Dr. Sonali is here. So thank you so much, everyone. If I missed anybody, I'm
Yes, ma'am.
kindly excused.
Thank you, Vinita ma'am, and thank you, Sonali Kadam ma'am, and other Shubhoth, and another Prasad. And I want to thank, first of all, I want to thank Dr. Raman Chaudhary sir,
Yeah,
and
actually,
then
he's the
Dr.
one I think you suggested.
Dr. our Professor
And
Emily
my team.
also.
So yeah,
Yes, ma'am. It was a nice presentation, ma'am. Thank you so much for your time, and I just like to thank you and Aman Chaudhary sir and my team and my department also for this. And I like to thank my Dr. Deepak Nalaswamy sir for this giving this opportunity for so many people to present, and
thank
my institution also, ma'am.
thank you so much.
Thank you so much, ma'am.
Uh, I think I can end it. I can.
Bye bye.